Welcome again. I will go ahead and get started with our intros, and other folks will continue to enter the room as I speak. But welcome to Justice in Public Health at the School of Public Health at the University of Minnesota. I'm excited to have you as well as our esteemed panelists today. Welcome to you all. I'm going to get started with our intro. First of all, my name is Lauren Jones. I use she, her pronouns. And I want to welcome you again to Justice in Public Health. I want to acknowledge that the School of Public Health here is built on the traditional homelands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, which loosely translates to the land where the waters reflect the skies. We'll share some concrete resources for supporting our Indigenous relatives in the chat. I also want to point out that closed captioning is available. You can access that by using the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who's providing our tech support today, via the chat to ask questions about accessibility. We'll monitor the chat for questions, as well as share links to our evaluation and information about future Justice and Public Health events. The Justice in Public Health series was started in 2021 as part of the School of Public Health's commitment to justice and anti-racism. We have been hosting monthly events with local and national experts around topics of public health since then. The speakers and presentations in the series help to ground us in theory and practice, as well as complement the classroom learning that our students experience. We also hope that today's discussion is part of a broader change happening outside of the School of Public Health. If you're interested in staying abreast of other justice and public health events, please be sure to fill out our event evaluation after this and check the box to receive notifications about upcoming events. You may also want to visit our website for this at any time. We are recording this event, so we'll be up to view after we complete today's event. And now I'm going to introduce our speakers for today. First of all, we have John Geffen. He's a lawyer and the director of the Legal Revolution law firm. John has a passion for assisting individuals helping individuals overcome barriers related to the existence of a criminal record. John has represented individuals in expungements, pardons, licensing matters, criminal court, family court, and more. He's written extensively about the inequalities faced by those living with a criminal record and is frequently contacted by policymakers and the press because of his expertise in these areas. John is also the director of the Reentry Clinic at Mitchell-Hamlin School of Law. Secondly, we have Rhonda Jones-Webb speaking. She is the Associate Director of Equity and Engagement for the Cannabis Research Center and a professor in our Division of Epidemiology and Community Health. Rhonda's research focuses on substance use, epidemiology, and policy, with a special focus on race, social class, and neighborhood influences. She served as a principal investigator or co-investigator on nearly 40 externally funded research projects and conducted studies on a variety of topics, e.g. alcohol use in African-American populations, implementation of policies related to high alcohol content beverages, alcohol outlet density, public policy, and economic development, and cannabis use. Her current research interests focus on how substance use policies can be more equitably implemented and how communities can ensure all citizens benefit from health policies. Rhonda is the founding co-chair of the School of Public Health's Health Equity Work Group and a member of the Alcohol Epidemiology Program, the Center for Anti-Racism Research for Health Equity, and CTSI / the Community Engagement to Advance Research and Community Health Council. Welcome, Rhonda. And our last speaker is Jess Jackson. She's the Director of Social Equity at the Office of Cannabis Management here in Minnesota. Jess brings an extensive expertise in health equity, nonprofit development, and regulatory strategy to her role at the Office of Cannabis Management. Previously, Jess served as the Director of External Affairs and Social Equity at Common Citizen, Michigan's largest vertically integrated cannabis producer, where she managed substantial reinvestment portfolios and pioneered innovative community benefit programs, earning recognition from state regulators. In addition to her cannabis industry experience, Jess has made significant contributions to nonprofit development and evaluation. She's worked with organizations such as Michigan College Access Network, Teach for America, National College Advising Corps, the Redemption Foundation, PS Society, National Expungement Works, and Michigan NORML, Normal. So welcome, Jess. And once again, welcome to all our speakers. And I will now go off camera and pass it to John.
Thank you so much, Lauren. I appreciate it. And I just want to say this is what a great panel, and I'm so honored to be on it and talking to you all today. So yeah, my name is John Geffen. I'm an attorney, and I work with the Legal Revolution Law Firm, and we provide civil legal assistance to individuals who are impacted by our criminal legal system. My part of our discussion today is going to be on not just the law, but sort of an advocate's perspective. Obviously, all these changes are legal in some nature, but I get to talk about something that's important to me and dear to me is just like, so where are we now with cannabis legalization, and how does it impact those people who have had interaction with our legal system? So all right, so I'll take maybe a step back and kind of talk a little bit about the war on drugs and why we're kind of where we are today. There's another slide that Jess Jackson's going to do that goes through a lot, and maybe multiple slides about sort of this thing that had happened. My focus a little bit will be on the kind of the most recent war on drugs, if there's such a thing, focusing in the 1970s to kind of where we are today, where we created a situation where we criminalized addiction, criminalized use, and in place of going after the people to a large degree who were the financial beneficiaries, we didn't do as much with education and treatment, but we created felony crimes for small amounts of possession. So if you think about the wars we've had, we have wars against countries, we had a war against poverty. It's a little bit of an incongruous thing to have a war against drugs when really you're really having a war against people. You were going to hurt people that were in society, oftentimes marginalized individuals, and it caused a lot of harm, and we still suffer the reverberations of that harm. And so I have a thing that says felony possession of more than in the past. And this is before August of 2023. If you possess more than 42.5 grams of marijuana, of cannabis in Minnesota, that's a felony. We have had a unique statutory scheme where if you had less than 42.5, it was a petty misdemeanor. In Minnesota, a petty misdemeanor is defined as something that is not a criminal act. It's a parking ticket. But then if you go over that threshold, for the most part, it's a felony. And I think as people now understand, and having a felony on your record and a drug felony is a huge barrier to living a full, happy, fulfilling life. In that people who were cannabis users were not people that we needed to be scared of. These were people who were our neighbors. People used cannabis in Edina, South Minneapolis, North Minneapolis, up on the Gunflint Trail. People use cannabis. And creating these felony records was a huge impediment for people to move forward. So you have this statutory scheme, petty misdemeanor and felony, and they were both flawed. When we decriminalized in about 1976, we said, oh, we're going to make this small amount of personal use a petty misdemeanor. Again, it's not a crime, but we made those records available, and we made those records public, and we allowed those records to be used by employers, landlords, nosy neighbors to make decisions about people. And they did. So we said, on one hand, we've decriminalized this, it's not that big of a deal, but we didn't tell the rest of the world that. And people lost jobs, and people lost places to stay. People suffered from it. In addition, we have a significant issue with all felony drug convictions in Minnesota are deemed crimes of violence. So if you're convicted of a crime of violence, and again, let's use cannabis. Let's say you have 45 grams of marijuana prior to August of 2023, you committed a violent felony. No guns, no knives, no threats of violence. You committed a crime of violence. And if you commit a crime of violence in Minnesota, you permanently lose your right to own and possess a firearm or ammunition. I'm not a big gun guy, but if you have a firearm with a prohibition against you from a conviction, you're going to go to prison. Those are significant penalties for people that violate that law. So you have somebody that might have had a small amount of marijuana in that sort of 45 gram range and will never possess a firearm again. If they do, they're going to prison. In addition to obviously firearm issues, there's this huge host of penalties that individuals suffer from having a felony drug conviction. Student loans, government assistance, public housing, private housing, employment, and more. And this is a huge impediment against you. It will be there in Minnesota until recently. If you have a criminal record, there was no automatic mechanism to make them go away. They stay forever, public forever. When I started practicing law in 1997, if you wanted to get someone's criminal record, you go up to the courthouse. Some of it was on a computer and a lot of it was in a book. So it was always public, but through kind of information, changes, all this stuff became really, really available. And it's used all the time. So one of the problems with that is the disparate impact these laws have on Black and brown individuals. So they have a few little stats here. Individuals, Black and brown individuals, 5.4 more likely to be arrested for cannabis nationally. 2020 report, 8 times more likely in Minnesota. The cannabis use levels, as I understand it, are pretty even, but the enforcement levels are significantly different. So take that downstream a little bit. You have communities using it around the same amount, but enforcement of just one. Those records are used, then you're going to have really significant disparate impacts in how those people experience the world in terms of housing, employment, licensing, and so on. Cannabis arrests, 35% of drug arrests. So I think this all has to be looked at as a bigger picture in the United States, the idea of mass incarceration. Mass incarceration is a trend over the last 50 years that saw a very stable percentage of incarcerated individuals per capita just explode. And, this is, I think, one of the most important charts to know about with mass incarceration. You can see it. What you can't, of course, do is feel it, because these are lives. And it's not just the life of an incarcerated person. It's the person who's connected to that person, their kids, their spouse, their parents. The ripple effects of this is damaging generational. So what happened? In 2023, we legalized cannabis, and it was a wonderful thing. And I'm going to fly through this a little bit. And one of the most important parts of this, and the most laudable piece, one of them, is automatic expungements. We agreed that expungements for these offenses that are no longer criminal actions need to be expunged. So we did it in 3 ways. Automatic expungement of petty misdemeanor cases, creation of the Cannabis Expungement Board for the felony cases. We passed the Clean Slate Act, which isn't designed for cannabis, but it will overlap and include some. It would include the 5th degree possession cases that I talked about, those felony cases at 5th degree, kind of lower level, but into the felony. All these automatic. We expunge nationally about 2,500 cases a year. This gives us an opportunity for people without the financial resources, without knowing a lawyer, to get an expungement and move past these. These are the most important things for expungement law in Minnesota ever. We're not done yet. Like anything that you roll out takes time and has glitches. BCA expunged 57,000 records in May of 2024. We were elated. We later learned that many, up to 29,000, didn't get expunged from court records. So they're still available on the court's database. The Cannabis Expungement Board is tasked with expunging 90,000 cases. That's a lot. How are they going to have a hearing on all of those? We have not seen many of these expunged yet. So you have people with cannabis expunged or cannabis felonies who could move past these, but we just haven't found the mechanism to make it happen yet. Clean slate law supposed to go into effect January 1st, delayed till May of 2025. We also have some federal stuff. I want to be very conscious of my time. I get 8 minutes. I think I'm at 8 minutes. Jess, I'm looking out for you. I'll put my mic down. Thanks, guys.
Well, good afternoon. I'm Rhonda Jones-Webb, and I'm the Assistant Director for Equity and Engagement at the University of Minnesota Cannabis Research Center. It's just a pleasure to be on the panel and just share some of the exciting work that we are doing at our center. So as John mentioned, recreational use of cannabis was legalized in 2023 in Minnesota. And as part of that legislation, funding was designated to create our Cannabis Research Center. So the major mission of the Cannabis Research Center is to really understand the public health implications of cannabis legislation and be a trusted source of information for policymakers and practitioners and the community as a whole. And so the both collaboration and equity are core principles that guide our work. For example, we will be conducting studies pertaining to equity in cannabis sales, marketing, and use. Our focus on marketing, especially focus on marketing to youth. And then also one of our core missions is to support that next generation of scholars engaged in cannabis research, to really develop a cadre of scholars who are interested in looking at cannabis policy and its effects on health and health equity. I mentioned that collaboration is also very key. And so at the center, we strive very seriously to create collaborations with state and local agencies, policymakers, community members, to really ensure that the information that we produce is responsive and accessible to all Minnesotans. This is a slide of our leadership. Tracy Toomey is the director. Darren Erickson is the associate director of research. And as I mentioned earlier, I am the director of equity engagement. And Julie Sanem is the research center director. So the remainder of my presentation is really going to focus on work that we are doing in our equity and engagement core. And so some of the goals of the equity engagement core include really building strategic and collaborative partnerships with marginalized communities to inform our research priorities. As John mentioned, the Black and Brown communities have been most adversely affected by criminalization of cannabis. To establish short and long-term goals to develop and conduct research focused on equity issues in collaboration with community partners. We're particularly interested in some of the social equity issues related to arrest rates, location of cannabis stores. And then to help build collaborations between communities and CRC, the School of Public Health, and the university. So I'm gonna just talk about some of our early work. We've been in existence about a year and we've hit the ground running. So much of our work is really focused on kind of setting the stage in terms of developing kind of partnerships and laying the groundwork for future research. And so as part of this effort, we conducted one-on-one interviews with among different stakeholder groups, people in criminal justice system, community development, government, public health, youth serving organizations, and education, with the aim of getting just diverse perspectives on the perceived impact of the legislation on social and health equity. Where this is, we're in the kind of early stages, but also really encouraging our staff to attend community events. And so particularly our graduate assistants have attended community events and volunteered to really build genuine relationships with community members. Also, we are going to keep in contact with those that we've had one-on-one interviews to kind of build relationships with them and keep them updated on the work that we're doing. I just want to talk very briefly about the one-on-one interviews. So the questions focused on 5 areas. What were high priority areas of interest for them around cannabis legislation? What did they want to know? What were some of their perceived benefits of the legislation, as well as drawbacks of the legislation? And then what were their recommendations for ensuring that the legislation was equitably implemented? And I'm just going to briefly share some of the results from that first area. What were people interested, areas of interest they were wished to know more about? And so these were some of the themes that came up. How do we balance the impact of cannabis legislation on both health and social equity? What are some of the trade-offs, right? If we increase the availability of cannabis, what are the implications for health, both positive and negative? How do we ensure community engagement in the legislative implementation process? What is the cultural context of use and benefits? And then a real key theme that really was pretty consistent was, how is cannabis being marketed and promoted to underage youth? Also, as part of our efforts, we're conducting focus groups that really build on the one-on-ones. These focus groups will specifically focus on African American, American Indian, Minnesota residents, particularly in the Twin Cities. And the questions will focus on the unique historical, cultural, and socioeconomic context of cannabis use within these communities, as well as perceived benefits and harms of the legislation. And so we hope to really get invaluable community perspectives on really directions for our research and our research priorities within the center. We not only want our research to be grounded in community, the lived experiences of communities, but also grounded in the research. And as part of this effort, we are conducting a comprehensive review of the literature on social equity and cannabis legislation. And just some preliminary results really kind of highlight the very complex and nuisance landscape where progress has been made in some areas. For example, we see as a result of cannabis legislation reduced arrest rates, but disparities really still remaining in this particular area. Similarly, the literature suggests there's been an increase in cannabis stores, particularly, but they are often located in affluent neighborhoods. And so finally, what are some directions for future research? Really looking at, for example, how is cannabis marketed to youth in marginalized communities? What are the effects of cannabis legislation on arrests for possession, social equity, retail licensing, criminal record expungement? And then in terms of implementation, a topic dear and near to my heart is, how is cannabis legislation being equitably implemented?
Thank you, Rhonda and John, for that, and for leaving me some time at the end. I appreciate that. So I am Jess. I'm with the Division of Social Equity at the Office of Cannabis Management. And as statute designs the work that we do, we promote the development, stability, and safety in communities. And there's an asterisk there on communities because we also define what an eligible community is, which is a community where long-term residents are eligible social equity applicants that have experienced a disproportionate negative impact from cannabis prohibition. And I want to go back to some of the information that John had shared, but we'll talk a little bit about what do we mean by disproportionate negative impact from cannabis prohibition. My office, and we can go to the next slide, my office is comprised into multiple lanes. We engage with and represent the community, so I love hearing that overlap with Rhonda's work in terms of really prioritizing community engagement. We administer grants. We have 2 within the Office of Cannabis Management, and I'll go through those, but there are multiple throughout the state enterprise that support cannabis industry and also substance use and substance abuse research and interventions. We act as the ombudsman person for the community to investigate complaints and provide or facilitate resolutions. And ultimately, we are the reporting leg around social equity to our legislator. We have a team of 8, our director, which is myself, our ombudsman person, our social equity analyst, grant manager, and 2 grant coordinators, and then an executive assistant. And we'll also have a dispute resolution coordinator to support that ombudsman person. So I like to call my social equity framework, or how we define, like Rhonda's big question that she ended on, is how is social equity being implemented within legislation, right? And it's what I call social equity in motion. It's not one pinpoint, and there are lots of conversations around what social equity should look like. If we ask John, he's going to talk about expungement, right? And how are we reducing the impact of criminalization on people's lives? Because we know that there are 48,000 barriers that folks carry when they have a conviction, right? When we talk about Rhonda, she might come at it from a public health perspective and a youth substance use perspective, right? When I talk to the industry, they want to know where licenses are going or who's making money in this industry, right? There are multiple and a myriad of perspectives around what needs to be prioritized and what is considered equity and social equity in this industry. And I think that our legislation has done a really good job carrying through some of those robust and often competing perspectives. And so how that looks is development. It is understanding the war on drugs. And I'm going to do a brief overview of how I think about the war on drugs and how I've been presenting and socializing that with stakeholders in our office. It really is a listening to advocates and a deep community engagement strategy. Our office has a CAC, which is 52 members deep, where we have experts from across the community and within the industry informing our rules and our processes and our policies to ensure that we're getting that feedback. And then it is our legislation and policy design. That stability, we're thinking about resourcing. How are we providing technical assistance? How are we providing community education? How are we providing justice reform and reinvestment? And then as we think about licensing, which is literally one spot on social equity, it is not the full breadth of social equity. How are we making sure that those communities that are most disproportionately harmed are ready to engage in the complicated and highly regulated industry that is the cannabis industry? And then as we think about safety, we're thinking about how are we continuously improving, right? What type of information are we getting from our enforcement team and our compliance team to ensure that the industry is reflecting those values of upholding public safety, right? How are we evaluating our public health, our community development, the industry performance, and how are we incentivizing good operators in this space? And so when I think about social equity and what that looks like in statute and in Minnesota law, it's not just one thing. It is a whole myriad of things that include the voices of multiple communities and multiple priorities. And we can go on to that next slide. But I want to ground us in the war on drugs. And the big thing that I want to call out, and this is also that you can do your own personal research on, is that in 1937, the fuel behind the fire that outlawed marijuana is incredibly xenophobic. I want you to look into Harry Aslinger and the first, he was the first director of the DEA. It wasn't called then back then, but look into the rhetoric that he used. And so the regulation of this plant is rooted in xenophobic rhetoric that targets certain communities. And we see that, as Rhonda and John both discussed, we see that carried through in today's impact. So we can go on into the next slide. Some key things of how that's carried through is our sentencing reform and how we introduced mandatory minimum sentencing for drug offenses, which led to the significant, we saw that graph from John's presentation, and we saw how much more we led to mass incarceration. And it wasn't just certain people that were incarcerated. There were certain groups that were targeted. And so today we're looking at reform that's been called on the table. However, there's a delay in terms of rescheduling cannabis through the DEA based on a pending resolution of an appeal that was filed by a party. But when you think about the war on drugs, it's really thinking about what is the root of this regulation? How has it impacted certain communities? And what does that look like for us in the future? And we can go to the next slide. A book that I always call out is The New Jim Crow, Mass Incarceration in the Age of Colorblindness, where we see some of those disparate impacts on certain communities, right? So in this book, there's lots of data to support and show that there are more Black men incarcerated than were enslaved. And so that is a key, and we talk about what that looks like and what our criminal justice system looks like. We could go to that next slide. So how did we address this in our policy in Minnesota? We have something called social equity communities, right? And we've outlined that as kind of 4 key populations. There's the military affiliated community, which are those veterans, and those who have been dishonorably discharged because of cannabis related offenses. There's our justice impacted, and I love the way that we define justice impacted communities here in Minnesota, because we're not just talking about those folks who carry a cannabis conviction, we're talking about the children or the descendants of folks who carry a conviction. We're also talking about the parents and guardians of folks who carry a conviction. We're talking about the full picture of those who have been justice impacted and those collateral consequences that carry through. When we think about our economically disenfranchised communities, we're looking at median family income, poverty levels, SNAP CDC, Social Vulnerability Index, and SNAP. Our SNAP rates. There's also some provisions around communities that have been over-policed. And so we're looking at those communities that have been over-policed around cannabis conviction. And then we have early stage farmers, which are farmers that have earned between $5,000 and $100,000. So we're looking at a breadth of people who have been impacted by cannabis prohibition, and that is informed by the community. And so we can go to that next slide. And so as we think about our legislation and how it looks and what are some of the key pillars of Minnesota law that advances equity, in that development lane, there's the development of the CAC, which is subject matter experts and youth. There are two positions for youth that engage with our office to continuously inform our policies and our protocol. We've separated out the medical and adult use supply chain to ensure that small business owners, or what Governor Walz likes to say, the craft industry can thrive here. We've limited local control, meaning that local municipalities cannot opt out. And we've seen in other states that when multiple municipalities, because there's such a stigma of this plant, when they opt out, there increases concentration into certain markets, which affects our social equity players. When we think about stability and the resourcing that we're providing there, we've provided automatic expungement, right, in multiple ways, as John discussed. And we have grant funding and low interest loans to not only reinvest in communities that have been harmed, but to invest in businesses that are emerging. And then we have some protections for those who are social equity qualified within the industry and employees, right? So you have protections if you are a consumer and you're employed. You have protections against termination due to your consumption. But within our law, we provide true party of interest to ensure that folks who are social equity qualified actually own their businesses and are not subdued to predatory practices around that capitalization. We don't require a site inspection upon licensing pre-approval, because we know in other markets that do require that, that puts people into debt early on. And then we have a lot of required reporting in order to measure the effectiveness of our industry. And we can go on to that next slide. I did want to give a brief overview, and I'm going to go very quickly over these slides to talk about our grants in case there's anyone in the room that might be interested in applying. But our Can Renew is a community restoration grant that is meant to target those eligible communities. And we can go to that next slide. It is between $50,000 and $200,000, and it is a year duration. Priority is given to communities with community support that support youth civic engagement, leadership, or support for youth-led health education opportunities, and that have a demonstrated history of successful community investments. And we could go to that next slide. Some of the investments that we're seeking, this is not meant to benefit the industry outright. It is meant to restore communities that have been harmed. So we're looking at economic development projects. We're looking at projects that improve social determinants of health. We're looking at projects that are creating violence prevention. We're looking at projects for youth development and civil legal aid. These do not have to be explicit to cannabis. And then we also have another grant called Can Renew, and we can go on to that next slide. We could skip this slide. Where we are investing into the development of an industry that includes farmers, both from a technical assistance lane and also a microloan lane, which is really important when we think about advancing equity. A lot of folks from these disproportionately harmed communities might not have credit, right? We're creating a low interest loan program to help folks access credit. And we're providing the technical assistance to help them be ready for licensure and to be able to operate in the regulated space. We can go on to the next slide. These grants are two lanes. There's the technical assistance grants, which is $10,000 to $50,000, and the revolving loan grant, which can be up to $500,000 for organizations that support farmers. And we could go to the next slide as we think about, and we'll skip this and go to the next slide. As we think about readiness of entering the industry, licensure is one point in the puzzle, is one piece of the puzzle, but it is not the whole puzzle of equity. But as we're trying to think about how folks can get ready, we know that certain communities will have a higher level of readiness. And we want to make sure that we're providing technical assistance to ensure that folks can get continually ready. And so we've designed a continuum of readiness that we use to inform our technical assistance grants to ensure that no matter where you are on this continuum of readiness, there are resources to support you in becoming a licensed operator within the industry. And we can go ahead to that next slide. So again, as we think about social equity within Minnesota, if you learn nothing from me, I want you to learn that it is not linear. It is continuous. It is in motion, and it is informed by community and by data. And it is about not just licensure. It is about justice reform, reinvestment, workforce development, technical assistance, and deep community advocacy to understand what resources our communities need.
Thank you to all our speakers. Really appreciated learning from you. And we're going to keep learning. So I do have a couple of pre-sent questions that I'm going to ask you. But while we are talking, I would urge folks in the audience to put your questions into the chat so that we can get to those in a few minutes. So I'm going to start off for our panelists, and you can go whichever order you want to go. Tell us why you are in this work. What brought you to cannabis research, advocacy, etc.?
I can start. I think it's two things. One, just my early experience. I worked at a minority mental health center in South Central LA, and I really learned about the power of research and policy to shape how people look at the world and how to change it. And so that's been my mission. So whether it's related to cannabis or alcohol use. And then second, as I mentioned, my research is focused on equity issues very broadly, but specifically to substance use. And particularly around an African-American population. And so I'm hoping to use what I've learned from alcohol, from tobacco to the cannabis field.
I could go next. Unfairness, unfairness in, I think it's a misguided war on drugs, unfairness with selective enforcement, and unfairness with this idea of perpetually punishing people for mistakes, or truthfully not mistakes, life choices. And so I think fairness has been a big part of that. I believe too, there's an organization, We Are All Criminals, that talks about the reality. If we're honest with each other, we all break the law at some point in our life. And the difference is some people get caught, some people don't. And that doesn't mean those who don't get caught are better. It just means they don't have this weight around them that leads to terrible consequences in life, and those feelings of hopelessness and helplessness, and not feeling power. So a lot's brought me here, and it's given me huge joy to work with individuals to help them in small way move past these records.
I think my work is deeply personal. I'm a descendant of the war on drugs, and I'm from Detroit, which is one of those disproportionately harmed communities. And so I'm called to work in cannabis and in cannabis justice reform because I know how it has affected my people. And I also know that a lot of to John's point, a lot of it is BS. Like it is just systemic xenophobia and racism in practice, and it is something that we carry through today.
Thank you all. I see the questions are coming in pretty fast and furious, but we'll get to you. Second question here is, as we continue to work toward equity in cannabis policy, what would you hope the landscape of cannabis policy looks like 20 years from now? I will call on Rhonda first.
I think there are probably three kind of, I think kind of features I would hope to see. One, that communities are actively engaged in implementation of the legislation and any changes. And then second, that any changes really reflect the kind of lived experiences of those most adversely affected by criminalization of cannabis. And that third, as I mentioned, that the policies, whether they're changes, are equitably implemented.
Any input from Jess or John?
Yeah, I mean, I hope that, and won't take this long, that we have full expungement and restoration of people who have had interactions based on this. That's my big hope. And that the other thing is, I think we need to get rid of having any limitations on it, in terms of like this many ounces, this many pounds. Like there's no like restriction on how many cases of whiskey you can have, right? Like, what's a wine cellar? I don't know if cannabis ages, but why can't you have a cannabis cellar? So I don't like any other things that limit it in a way that's unnecessary. So, because I think one of the hopes is we don't have some background ways for people to continue to have records based on this. Moving past it and coming up with something that just makes a little more sense in terms of possession, in my opinion.
I also want folks that are in jail right now to be free. And on that same vein, folks that are incarcerated, for them not to be forced to subdue in labor. I think that there are a lot of collateral consequences around the criminalization and stigmatization of this plant. And I would hope that our stigma decreases, as also while we get educated on the health impacts of the plant. But in my community, cannabis is like oregano, and we treat it like it is crack. And so, and there is just this there's a misalignment between what it means to certain people and what it means to the law. And so I would like to see that alignment become better and more clear, so that we're not creating stigma against people who consume, making sure that we're also upholding public health and safety standards, but that we're not creating more harm from the plant, and also making sure people get free.
Yeah. We had a couple of people send in questions ahead of time, so I just want to see if I can cover a couple of those. How do we balance the government role in regulating cannabis vendors against the backdrop of heavy-handed law enforcement?
Well, I can talk from a regulatory standpoint because we are the folks who intake complaints and investigate and inspect spaces for compliance to the law. So there's this, how do we have equity in our approach while also how do we enforce the law? And so there is a balancing act, especially as we're in the emerging stages of the market. So what does education within compliance look like? What does communication and proactive training look like? What does partnership with our law enforcement teams look like, so that we are able to have a positive engagement with the community? But ultimately, there is that balancing act of like, how do we make sure folks are informed of what the law is? And how do we make sure that people are abiding by the law? The reason why some of the laws exist is to ensure that we're not consuming heavy metals in our product, right? So that we can make sure that we have safe access to quality product in the industry. And so we're working on that balancing act within our office.
Yeah, I'd like to build on what Jess mentioned. I think, increased education really is going to, and communication is going to really involve encouraging kind of dialogue and building relationships among, vendors and law enforcement. And I think that'll be very key. And the other is, when I think in terms of the really emphasis being on monitoring versus harsh punitive enforcement, and that when monitoring and enforcement occurs, that it is done equitably.
I think, as an attorney perspective too, just the lingering pieces with, cannabis in a car, what police can do when they smell cannabis. I think there's the criminal defense bar is going to be active in participating in appeals to make sure, to fight anything that's deemed heavy-handed or unconstitutional. So I think the criminal defense folks are going to be involved throughout this.
What are some entrepreneurial considerations, i.e. business ideas, for public health professionals interested in cannabis?
Okay. I can take that question. I think one role, for public health professionals is really providing cannabis education and consulting. So, how do we ensure product safety? How do we minimize underage youth access? Perhaps guidance and navigating the various regulations, promoting safe and responsible use, and really providing accurate information on benefits and harms.
And I remember Jesse said research would be a big part of that as well. So some of you are very, very skilled at research, data collection, analysis, etc. So that would be a great opportunity. Let's jump into some of the questions in the chat. There are more than we can get to probably, but we'll try. Let's see. How is the CRC funded, Rhonda? Does this affect the University of Minnesota federal funding?
The CRC is funded through the legislation, and it does not. So we can, in addition to receiving support from the legislation, we can apply for grants at the federal level. So I don't see the fact, our source of funding affecting seeking other sources of funding for our work.
It looks like there's a couple of questions about the scheduling, which we had talked about ahead of time. How are we in the process of addressing the criminality of cannabis at the federal level? Just, do you want to cover that?
So that is they're not completely decriminalizing, they're rescheduling, which is different. And so a lot of cannabis advocates are proposing to decriminalize. But the hearing on proposed rescheduling has been delayed or postponed because there were some appeals filed while they were doing some of that investigation. So that is still in limbo right now at the federal level.
Can I amend one of my answers earlier to include consistency, like what we hope for in whatever years, that we have consistency between state and federal? It is a weird thing that you have cannabis illegal at the federal level, legal at the state level, whether you're in public housing. There's just all these weird components to it. And I think just from a, if you're a person in community, like that's confusing to understand exactly. What if you're on federal probation? If you're in federal housing, these are complicated things. It'd be really nice to have some consistency on this and some real stuff that kind of makes sense again.
Yeah, good point. What if you're on federal land within a state that is legal? Like, yeah. This is an interesting question from Sean. He says, I usually hear more fear and judgment on this topic. How can I help bring this perspective to my organization and community conversation? So this question of equity and looking at it in a broader way from public health perspective, I think.
I think I can jump in, but I think one, framing the history is how I always lead conversations. So talking about the history of the criminalization and the stigma behind the plant. And then also I talk about some of the like medical benefits and some of the health concerns. So there was a flag that was like, be careful not to associate cannabis as oregano because it can lead to psychological dependence and serious long-term issues. And while there is cannabis use disorder and folks can absolutely abuse any substance, I challenge folks to think, what comes first, the chicken or the egg? Are they responding and disassociating because of their mental health issues, or are they responding and disassociating using cannabis because cannabis exists? And so while I think through it, it is challenging mindsets, and helping folks to really think through what is informing our perspective in this moment. Are we being clear on what is informing our perspective, or do we have a little bias? And so like challenging some of that bias, because even I started in the industry as a consumer and a consumer advocate, but as I look into research around hormonal balances as a woman who wants to get pregnant, there's research that says that cannabis consumption at my age with my hormones is not actually good for me. So making sure you have the whole perspective and you're really mitigating some of the bias that might come up.
Yeah, and along those same lines in terms of really, I think, emphasizing that we don't know everything about cannabis. There's really just still some unknowns. Some of the kind of studies that produced kind of inconsistent results. And so we don't want people to overreact in the absence of good information and good research.
Thank you. There's a question for Jess. How does the OCM balance and respond to pressures from those ready to open and operate and wanting the licensing and process to move quickly in context of the goal of carefully implementing the equity elements of the law?
That is, if you look at any regulatory agency across the country, cannabis is a completely litigious industry. And so while we try to balance what is written in law, follow timelines from our legislators, and ensure that we're prioritizing things that are called out for equity, that doesn't mean that folks won't rally up against that, right? And install it with lawsuits or force changes. And so it is a constant reevaluation of like, what needs to happen now and what do we have at our hands and at our disposal in order to ensure equity. So I think that like our legislators put some timelines in place that were really expedited, that led before technical assistance was available to provide that readiness, right? And so as we think about what has to happen versus what is currently happening, it's always a flex in making sure that folks know what's forthcoming. And I think that one of the things I didn't name is that we have preserved some level of craft industry in Minnesota with our caps. We actually are I come from Michigan, which is oversaturated. It is completely oversaturated. We have high levels of vertical integration. And so there's very much a lot of competition and a lot of opting out. Whereas in Minnesota, right now, we have local control. We also have very small caps on our license, and we limit vertical integration. So whether you enter day one into the market, there is still opportunity for you beyond day one. And so I try to help folks understand that the way Minnesota has structured their industry is very much in favor of our small local craft operators.
What public education is available for a consumer given medical field knowledge and practices seem to lag changes?
I can just briefly talk to some of the work that we're doing to really try to find out some of those, answer some of those questions. We have conducted a survey with public health officials and public health departments to really get a sense of what information they need to work with the public to, inform consumers. We also have a survey with educators to, again, get a sense of what their needs are in terms of conveying information about cannabis to youth.
I don't know if you can answer this, but it says if cannabis use in veterinary medicine becomes legal in the future, how would it impact society? Would it aggravate some of the current problems? I don't think we have any vet med experts here, so what other data sets may be available for cannabis policy?
We'll put in the chat some of the links to our reports from our office and from MDH in the chat. So if you want to check out some of those data sets, those exist. And then we have some also data sets around our medical market as well. So you can see how folks are using cannabis medically, what they're using it to treat for, and how different communities are represented in that medical market.
And our center has produced 2 briefs that look at cannabis use and opinions and perceptions based on existing data sets, and they are available on our CRC website.
All right, I think I covered every question that we could answer here. What I will say is that we would love if you would fill out our evaluation. This has been a fantastic panel, and I think we've learned a lot. I'm also like, we could do this for another hour and still have more questions, but maybe we'll have to have you all back. We'll see. The other thing is that we do have the next Justice and Public Health event scheduled for next month. One of our favorite health equity, birth equity scholars, Asha Hassan, will be coming back to talk to us about bodily autonomy as a public health imperative on February 11th. Again, it is free and open to anybody to attend. You just need to register. Thank you all for attending today. Thank you to all of our panelists for being amazing and knowledgeable and answering lots of questions. I hope you all have a fantastic day. Take care. Stay warm.
Bye-bye.